The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Addiction spread further into every corner of Ontario during the pandemic. Tonight, voices from across the province on what they need to confront the unrelenting opioid crisis. Also, the cannabis retail reckoning underway on a high street near you. It's Thursday, September 15th, and that's ahead on the agenda. According to the latest coroner's report, Northern Ontario saw the highest mortality rate from opioids of anywhere in the province during the pandemic. And in addition to that terrible loss of life, there are the daily realities of the toll that addiction takes on everyone. How are public health and the respective communities dealing with all that? Let's ask. In Thunder Bay, Ontario, Cynthia Olson, Manager of Community Strategies and the Drug Strategy Lead for the City of Thunder Bay. In Timmins, Ontario, Dr. Leanne Catton, Medical Officer of Health and Chief Executive Officer for the Porcupine Health Unit. In Sault Ste. Marie, Ontario, Hilary Cutler, Manager of Community Wellness for Algoma Public Health. And in Sudbury, Ontario, Dr. Penny Sutcliffe, Medical Officer of Health and Chief Executive Officer for Public Health Sudbury and Districts. Thank you all for being here with us tonight to speak about this really important topic. Usually when we start the show, we start with data and numbers, but I'd like to show the viewers something a little bit more visceral. Penny, those crosses are located in Sudbury. Can you tell us about them?
Yes, these are crosses where the mother of a young man who died in Sudbury from the drug toxicity first put a cross to bring attention to this issue some 2 years ago, expecting that perhaps there might be a couple more that would go there. I think it's risen to about 244 crosses now, tragically, of individuals who have died in our community, sons, daughters, sisters, neighbors, from the toxic drug poisoning crisis in our area.
And you mentioned sons, daughters. These are our family members, our community members. How important is it for us to keep that in mind instead of just looking at the numbers?
Oh, thank you for saying that. It is incredibly important, and this is such a poignant notice and symbol for our community. It's in a busy section in downtown Sudbury, lots of support from a city council that it be there as a reminder about the huge impact and the toll and the people behind those tragic numbers and the statistics that you're referring to.
We do have some numbers to look at just to give people a sense of the urgency of this issue. From April 2021 to March 2022, the Thunder Bay District Health Unit had an opioid death rate of 82 deaths per 100,000 people, more than 4 times the provincial rate of 18.7 per 100,000. 5 other health units in northern communities also topped the list of opioid-related deaths. The second year of the pandemic, Public Health Sudbury and Districts had a rate of 53 opioid-related deaths per 100,000, and Algoma Public Health in the Sault Ste. Marie area, a rate of 52 per 100,000. North Bay Parry Sound District Health Unit, 41. Northwestern Health Unit in the Kenora-Rainy River region, 40. Porcupine Health Unit saw 34 deaths per 100,000, respectively. Hilary, can you give us a sense of why opioid deaths are happening at such alarming rates in Northern Ontario?
Yeah, and I think it's important to recognize that health disparities are greater in northern communities compared to southern communities. We have greater rates of poverty, homelessness, and as we are seeing with the opioid poisoning crisis, higher rates of substance-related harms. And a very important part of this conversation is the fact that our health outcomes are greatly influenced by social and economic conditions. These are what we call the social determinants of health. They are non-medical factors that influence our health. They include income, education, early childhood development, access to services, to name a few. So when we look to the social determinants of health, we can then begin to understand how issues such as trauma, limited access to services in rural communities, colonialism in the north, and simply stressful life events can then lead someone to substance use initiation, and thus the vicious and dangerous and tragic cycle that we are seeing with the opioid poisoning crisis.
Leanne, Hillary mentioned the social determinants of health. People may be finding ways to cope with their lives because of the things that they have to navigate on a daily basis. It's a tall order to deal with the crisis at hand, and also to address poverty, childhood trauma, being unhoused. To what extent is your jurisdiction able to cope with a crisis, let alone to prevent it?
It's an incredibly important question, and exactly what Hillary mentioned is where public health does need to focus our time and energy. We really continue to strive to work and increase priority in the area of prevention, of ensuring that we have safe, connected, healthy communities, that we're supporting the policies and the processes for early childhood development, that we're looking at housing, we're looking at income, that we're looking at trauma-informed care, and all of the items that really we know impact substance use and lead to this tragic outcome that we continue to see. And you're right, it's challenging in the middle of the crisis that we're seeing to make sure that we're putting that time and energy, and that we really continue to see the funding and priority in prevention and upstream measures to really address the social determinants of health and the complex factors that really lead to the crisis that we're seeing currently.
Did the pandemic make the situation worse with the opioid crisis?
Definitely. I think we saw that clearly across Ontario. We know that individuals tended to be using alone more often. We know that support systems were broken or sort of, not available as they had been prior to the pandemic. And so we definitely saw that in the numbers and the tragic losses across the province and across our region, and definitely something that we need to continue to focus on the upstream prevention, and also ensure that we have the emergency supports in place to save lives while we're working on the comprehensive approach for all of this.
Cynthia, during the pandemic, we were obviously, at some point of the pandemic, we were kept apart to keep us safe. People lost their livelihoods. There wasn't that, a lot of the resources that we had were focusing on helping us navigate during this pandemic. Many drug strategies have 4 pillars: prevention, harm reduction, treatment, and enforcement, but Thunder Bay has a 5th. What is that 5th pillar, and why is it so important?
Yeah, thank you for that. We, in the consultation period in our community when we were developing the drug strategy, it was loud and clear that housing needed to be at the forefront as well as part of a comprehensive strategy. I mean, I think certainly you've heard from the other guests tonight that the social determinants of health are really, really critical. And our community felt that in order for people to get well, you really needed to have safe, affordable, and stable housing. And so that's why we embedded the housing pillar within the other pillars for the drug strategy in the community.
Hillary, we're talking about housing. We're talking about the urgency of combating. It seems as if every day we turn on the news, something new is happening, and our resources that we have need to be directed to something else. What would you say are the social and economic policies that we should be looking at for the longer-term solutions?
Oh, and in response to that question, I would say that it is across multiple sectors, and it's multiple partners at the table discussing and collaborating at the local level and at our northern level as well, what might be most appropriate. I will say that it does span across housing, it spans across childcare, entry into the workforce, income, for example. I know there was a pilot for what a basic income could look like in Ontario. And all of those things need to be on the table when we're talking about systems and structures that we can put in place to support people economically and socially.
And Penny, we've heard before of situations where doctors prescribe people with medicine that they end up being addicted to. What would you say is causing the situation we have right now?
Well, that's really interesting because we know that we understand that earlier on in this crisis, a lot of the situations were as a result of prescribing for pain, and then individuals becoming addicted and then looking to street supply when they couldn't access that through their healthcare provider. I think less and less we are seeing, much less and less we are seeing prescription medications involved in opioid poisonings and really the street supply. And so So although, of course, it's incredibly important that there is appropriate pain management and there are excellent Canadian guidelines supported by the associations within Ontario, very, very important. But we also know that, in fact, it is the toxic street supply, this toxic, unregulated supply that is killing people. So it's an important avenue. And the other thing I might reflect upon with your previous questions is that this is a messy, complex problem that is going to take, messy, complex solutions. And we really do need to think out of the box. We need to, all of us, see ourselves in the picture and as part of the solution, because it's not a simple fix. It's not a vaccine. It's not a one strategy with prescribing, et cetera, but all of these many pieces combined together that will ultimately see us having some success. It's tragic all over, and particularly so in Northern Ontario.
I just want to follow up with you, Penny, on that. You used the term messy and complex. When you say that, what do you mean?
So if we think about a problem, so even COVID, which has not been not complex, but we know that the vaccine has been a really tremendous strategy, and certainly the public health measures that were put in place that helped to protect us all. This issue, as has been highlighted by the other speakers, the other guests, the social and economic determinants of health, right from, how do we prevent the push and the pull, the draw to use drugs in the first place, to how do we actually help people to reduce the risks if they are using, so that they're not dying and there are further reductions in risk to their families, to their communities, and obviously to themselves. So things like the work that we do in schools and resiliency, connecting the dots between that work and the ultimate goal, in this instance, of reducing the risks of drug use. The enforcement pieces with the drug suppliers in the first place, the toxic supply and thinking about safer supply, or the status of the criminalization of drug use. All of these things together really make it a very complex and a very messy problem, and I think a very difficult problem for policymakers to also get their minds around, to think about what are acceptable solutions, where are our values, how do we value people who use drugs, and how do we make sure that we have all hands on the table to do what we can to reduce the risks.
We are going to get into some of those solutions, and some people say that these solutions can be controversial, because I still do think that there is a certain amount of stigma on whether around drug use. But one of the solutions has been to have safe injection sites. And Sheldon, you already have a 4-shot, but I wanted to get an idea from all of you. How many of your regions have safe injection sites right now? If you can just show a raise of hand. Kind of? Okay, we'll come back to that. But Leanne, I want to come to you. Vancouver has had a safe injection site since 2003, almost 20 years. Why has Ontario been so slow with safe injection sites?
I think it's a really good question. And part of it, I really do believe, is the timeline of the crisis as we've seen it sort of move across Canada. It's an important indicator, and I think something we're able to learn from the tragedy and the outcomes and the lessons learned in BC. But really, when we look at 2015 and 2016, the numbers in BC, when they declared the public health emergency for the opioid crisis, their numbers were much higher than what we were seeing in Ontario at this point in time. They also saw an earlier increase in the toxic poisoning of the drug supply with fentanyl and other opioids. And so we're seeing those numbers in the last few years, and definitely following the trends that have been seen there. And I think that is a part of it, but important to recognize that that we can learn from the unfortunate tragedies that they've seen there. And I think we are and able to move quickly.
I think one of the things that happens is sometimes when we have these conversations is that we assume that everybody knows how these things work. So Cynthia, you have a treatment site. Can you give us an idea of how that works?
Yeah, sure. It's operated through a community health center in partnership with Delico and Anishinaabeg Family Care. And really, it's open 7 days a week, and individuals can connect in for service. They don't have to use the supervised consumption component of the service, and we're actually seeing a large number of individuals, connecting for other health and social services within that setting. But they're able to also connect with a healthcare provider who would oversee them using their substance. So right now it is generally by injection. Typically in Ontario, I don't think there's any supervised consumption site that actually permits safer inhalation inside, which we know is also a challenge. And then individuals are then monitored and able to be responded to in a very timely fashion if they do experience symptoms of an overdose. We know in our own local supervised consumption site that there have been overdoses, and those have increased over the years, certainly as we've seen a toxic drug supply coming into the community, but not a single death. So that means that people are well connected and being able to be responded to, and then are well engaged in the treatment services and harm reduction services in a community.
Can you expand on that? Because I think the why that is needed, because some people might say, well, you shouldn't be doing drugs in the first place, but why is it important to have a site like that?
Because people matter. Like we talked about right at the outset, you showed the crosses. This is people's family. This is our community members. This could be my brother. This could be your sister. People matter, and if we don't save lives, there isn't a possibility for them to get well. And we know that the recovery is possible as well. We're talking today in Recovery Month across Canada. It's really important that we give opportunity and connect people to the services that would make a difference in their lives.
And Leanne, is there also a part of the acknowledgement and the acceptance that people will be using drugs?
I think for sure. I think it's similar to other health activities that people undertake for one reason or another that may not be the most healthy for them, and we need to understand that individuals have faced tremendous, hardships, and as we mentioned, really needing to address the root causes and the complex factors, as Penny mentioned, that really can lead to individuals using substances, and making sure that we have those wraparound supports and services. And I think the most important thing that Hillary and I think all of us has said is, these are people, these are community members, these are loved ones, and we don't have the same hang up about other medical conditions. And it's really, really unfortunate, because I think it drastically impacts people's ability to admit that maybe they need help before they even use substances. It drastically impacts people's ability to reach out for supports and services that they do need. And unfortunately, it often impacts our abilities to have conversations and open our minds to what needs to be done. As Penny mentioned, it's not easy. And we really, it's all of us. We all play a role, whether we're in public health, whether we're in education, healthcare, social services, mental health, or addiction counseling. Every single community member has to be on board in order to save lives and in order to prevent this from continuing to increase.
Well, Timmins has a new safe injection site with over 600 visitors in your first month. How hopeful are you that the death rate will come down now that you have that site?
I'm very hopeful. I think we have to have that hope. I think the other thing to keep in mind is that we have to continue doing all of the other work. As mentioned, we need to continue to address the inequities, the social determinants of health that the population faces. We need to continue to ensure that we're looking at supports for individuals when they stop using, once they do access the support and services that they need. And I think the other important indicators that we see with safe health sites, such as Safe Health Site Timmins, is that we know the evidence is that it saves lives. We also know that the impacts of connecting people to supports and services is critically important. And so beyond the visits for actual consumption, as Hillary mentioned, really making sure that people have an opportunity to connect with others, that they're seen, that they're heard, that they can be referred to addiction and other services, as our site has been able to do over the last couple of months, as well as ensuring that people have access to medical care. We're able to share local, alerts or trends, make sure that people have other supports, even food, water, snacks, washroom. It's really an integral opportunity to connect with individuals who use substances while working on saving lives as well, obviously.
Hillary, your region is the only one that doesn't have a site. Would you like to have one in your region? Would it help?
We do agree. Yes, of course it would help. There is an acute need for this service, and there are people who would use it. And to speak about some of the points that were just mentioned around stigma, when we think about this opioid poisoning crisis from the lens of human suffering, rather than the substances that people are using, our frame and our approach becomes more compassionate, more empathetic, and this can go a long way towards reducing stigma in the community, which is why an understanding of the social determinants of health is very important. So much happens in someone's life before they need to step into a treatment center or before they need to seek services. And our work must incorporate an understanding of this and the collective actions to address those social and economic conditions. So certainly those sites are part of it, and we do support such a site in Algoma. We just don't have one at this time.
You mentioned stigma because I know there's even within Toronto, there's still stigma on just drug use itself. Do you think that maybe we need to have more open conversations about the prevalence of drug use in order, if people do need help, they know that they can actually access that help? Hillary?
Yes, yeah, I do think the conversation needs to continue at all levels, and it needs to be informed by the people who are in the system experiencing stigma themselves. And that is something that I think my Northern colleagues have undertaken or conducted with their partners similar to us in Algoma. We are currently speaking with people who use substances to understand barriers to recovery or wellness, and also understand the stigma that they face in our community so that we can honor their voices. They've had courage to speak with us and amplify this message so that others in the community can understand the crux of stigma and what it really means and what it really looks like. And these personal narratives will go a long way. So the conversation does have to continue at multiple levels.
Penny, you said you kind of have a site because it's not open yet. You've talked about a safe supply. Offering a safe supply can be seen as kind of a controversial topic. How would we even start that type of program when we're so behind on safe injection sites?
The drug supply is toxic, it's unregulated, and it is killing people. And so I think labeling that, naming it, surfacing it, and having really straightforward conversations about that fact and what are the solutions to deal with that fact. If we had alcohol that was contaminated and was killing people, we would do something about that. People are using drugs. Whether we have values associated with that or judgment or stigma is beside the point. It is a fact, and so one of the measures certainly would be to look at safer supply. I'm not an expert in this area in the slightest. However, we are familiar with other jurisdictions where this is being tried. It is one of the tools in the toolbox in combination with all of the others that have been discussed today. I really think that, especially in the North, where our death rates, not even going to emerge or EMS, visiting sites, etc., the death rates, the tip of the iceberg, is 2 to 3 times higher than the rest of the province. It is killing people. And so to my point earlier about it's messy and it's complex, but with that, we also need to make sure that we look out of the box and, do not turn away any solution as a possibility, but really have a very, very close look at all of them. Keep all the doors open to consider what might be an effective solution for the North, both from the prevention end, as our colleagues have spoken about, through to the harm reduction and being safer supply and or safer use opportunities. It's a crisis. It's very, very critical.
We have about 5 minutes left, but I just want to follow up with something, Penny. You've called this an opioid poisoning crisis. Why poisoning?
Well, because most of the vast majority, over 90% of the deaths are not intentional, they are accidental. And it is because people who are using drugs, and we absolutely need to include them as a really important part of this conversation. I might encourage you to think about that for your show in the future. But persons who use drugs are not looking to die. It's accidental. They do not know what is actually in the substances that they are taking. So these are drugs that people are using that are being poisoned. the quantity and the quality are unknown for people who are really suffering from a medical disorder or a disorder in terms of addictions, who deserve and need better treatment.
Cynthia, we've heard of stories of people using just one time and then them dying. What are your thoughts on providing a safe supply?
Well, we're actually fortunate. We just had an announcement that a safer supply program will be launched here in Thunder Bay. I think it's really critical. For individuals who are maybe using recreationally or one-time use, that may not be the best option. I think there needs to be a broader conversation about regulated drug supply across the board. But right now, the safer supply programs are really targeted at individuals who are really in acute need based on their level of substance use and the level of harms that they're experiencing because of it. They're generally quite small. But I think it goes hand in hand, like we've been talking about, a comprehensive continuum of options in a community. We need, alongside that conversation, we need to have the conversation about decriminalization or safer supply on a more broad scale. I think one of the guests talked about alcohol, and we have an opportunity with the way alcohol is regulated that you can issue an alert when something has gone wrong with that because it's regulated. There's there's checks and balances. We don't yet have that option. And so it's really incumbent on communities right now to be monitoring and relying on intel from community partners when there might be a spike in toxicity in their community and sending out alerts.
Hillary, I'll let you have the last word. Where do you find hope? We hear all these numbers. Where do you find hope in those numbers that point to this crisis being worse and made worse by the pandemic?
That's a complex question, and I think that there is always hope. Anyone who is working in this field and wants to help people, because it is at the core, it's about humans and helping each other. So, there is hope in that the conversation can continue. We can continue to work on stigma. We can continue to work with our policymakers at the provincial level to just be mindful of the social and economic issues that affect health, and together as a community and as a northern region, we can just do our best. It is all about working together, and I think that there's just simply hope in that. So those would be my final words on that.
I really do appreciate all of your time and expertise on this. We really do appreciate it, and we send our thoughts to all those families that have been impacted by this during this crisis. Thank you so much for your time. The human cost of the opioid crisis is devastating, but there are also real economic and social costs to this health emergency. Cam Guthrie is mayor of Guelph and the current chair of Ontario's Big City Mayors Caucus, which collectively represents almost 70% of the population of the province. He joins us now from Guelph. Hello.
Hi, thanks for having me. I appreciate it.
It's very nice to see you here, Your Worship. You're not only the mayor of Guelph, you're also the chair of Ontario's Big City Mayors. That's cities with more than 100,000 in population. What are you hearing from the largest city mayors about the opioid crisis?
It is a constant conversation that we are having as a caucus. It is a priority issue for the Ontario Big City Mayors. And it's a priority because we understand that we want to help the very people that are struggling with these addictions. And I think that can't be lost in the conversation because there, of course, are impacts that we might start to discuss, but we all have our hearts and our minds set on trying to help the individuals, in recovery, to find a pathway out of addiction or the mental health crisis that they are having. But it is a top of mind conversation. And that's why back in June, the Ontario Big City Mayors unanimously called for an emergency meeting with the province of Ontario and to get together on this issue because it is playing out more and more and more in our cities every single day. It is a real crisis and we need an urgent response to it. So we're hoping that we get together soon with the province, along with others, to try to figure out a pathway forward to help the people, but also our cities.
We've talked about stigma when it comes to drug use, but also when we're talking about these problems, we also don't want to stigmatize communities, because then it just becomes kind of like a self-defeating prophecy. Throughout the province, very different needs. But what is the difference between larger cities and smaller cities when we do talk about the opioid crisis?
Well, so often we see the opioid crisis is playing out everywhere. So that is a foundational statement. But when it comes to some of the services that can be provided for people that are struggling with addictions, whether it be housing supports or food insecurity, or safe injection sites, or other type of agencies and stakeholders that would have some wraparound service for individuals, they are often found in our bigger cities. So you will have people from our own cities, of course, struggling with this and then using those services. But then across the province, if those services aren't available in their communities, they tend to find their way to the nearest urban setting to find those services. And that's why we're also seeing a spike of individuals come to our cities to find help.
And I guess that can also create problems, because if you're leaving your home community, where maybe you have your community support, to go to a different city, you might get lost in the big city itself, and then that just creates other problems. Municipalities and cities are dealing with the opioid crisis up close. To what extent are cities equipped to deal with this?
So we're clearly not, and this is the big problem, because it's a healthcare issue. And the province has the jurisdiction over healthcare. Municipalities are not structured either with the staffing or with the financial capacity to be able to step into this arena. Now, that doesn't mean that municipalities are ignoring the issue whatsoever, or are not trying to figure out ways to help, because it is a crisis. But the jurisdiction of this issue is healthcare, and that's where the province does need to step in and work alongside us, because I think it should be an all-of-government approach, federal, provincial, and municipal, along with other stakeholders, to try to figure out a pathway forward to help these people that are struggling, but in the same time help, especially in our downtown cores, where this is playing out for all to see, with the impacts that are happening there as well.
You mentioned that this is a healthcare matter. How would you describe how it's being dealt with right now?
Well, your guests prior to me stated some things very clearly. It's like puzzle pieces trying to figure out how things can come together. And so everyone's trying to do their part. There's still some silos, I think, that need to be broken down, and that's why I indicated it should be an all-of-government approach. But we do have a lot of services in all of our communities trying to figure out a way of helping with this, whether it be from the healthcare side, or, as I said, the food side, or counseling side for people to try to get them the supports that they need. But at the end of the day, I'll tell you, the main support that everyone is trying to focus on is housing. If we have a housing first perspective for people, that will help, because most of those that are struggling in the open for all to see with the opioid crisis is those that are unhoused. And so if we can get them into a place of dignity, a place of security and safety for them and their stuff, their belongings, we can have that arena, that positive arena where they're in, to start wrapping them around with the supports they need. And so we really need the federal government and the provincial government to step up and help our communities when it comes to supportive housing and the wraparound services that are required for supportive housing. Until we have the housing, it's going to be very, very difficult to try to deal with this issue as it's playing out in our public square.
Well, you've said the opioid crisis needs to be treated as an emergency, the way we've dealt with COVID-19, emergency measures. Dr. Penny Sutcliffe in the previous conversation said, there's no vaccine that can treat addiction. So how realistic is that?
Well, I think what we learned over COVID is that number one, we recognized that it was an emergency, that it was a crisis situation. And then that immediately changes the culture and our attitude towards finding a solution to help people. And I think that in some cases is being missing here on this issue even though everyone's sounding the alarm, we're sending up the flares, and we've been sending up the flares for a while, but COVID has just exacerbated that issue into the forefront, into the public square. We're all seeing it play out in front of us now. And I just wish that many other upper levels of government, especially, would actually listen to the mayors of cities, listen to business owners in our downtown that are saying that they're struggling, to actually take it really, really seriously. If we were able to have that sort of COVID response to the opioid crisis, I think we would actually get a lot further, a lot quicker, and we would save lives.
We heard that lockdowns made it worse for people who were dealing with addiction. People lost their jobs. How did the COVID pandemic and the measures we had to take, the stay-at-home orders, the fallout from the job losses, make this already critical situation worse?
So I think what's happened is that many people that were requiring certain supports and were requiring those supports when COVID hit and lockdowns hit, those supports weren't easily accessible. They started using, especially drugs, on their own. It became a lot more risky. Now what's happened is during the COVID response from the upper levels of government, there was some funding that came down for social services to help with those needs. But now that funding is going to be gone. And so that is probably part of the problem, again, where we have a set of funding that started to actually show some results for our cities. And now that funding is going to be taken away. And one of the key points that myself, other mayors, even public health units are trying to state is saying, you got to try to figure out how to keep that funding going that we had during COVID, because it was making a positive difference. And we need to see how it could play out, especially as we come out of COVID, which with much more use, unfortunately, that we see because of the impacts of those lockdowns and COVID was having. People are using more.
We talked about how this crisis is hitting larger cities, often in the heart of those central business districts. What is the impact on those downtown cores?
It's rampant, and this is an urgent issue. The open drug use and mental health issues that can be associated with opioid use is rampant and playing out in the public square. We often said, especially mayors during COVID lockdowns, support local, support local, support local. And everyone was instead going to, websites of certain companies to order their goods or services. And we kept saying, support local, support local. And so people now wanted to do that in our cities. They wanted to go downtown and they wanted to support all the small, medium-sized shops that were there. And instead they come and they are faced with open drug use, vandalism, damage, and the business owners are just coming out of the COVID lockdowns. They just barely survived. And now they're becoming like social workers. Instead of trying to concentrate on their business, they're trying to help with the person that is passed out in their doorstep. It's hurting business owners. It's hurting with trying to retain staff for them. It's hurting tourism. It's hurting all the resources that are required to try to beautify and continue to make our downtowns a place where people want to be attracted to. And so it's rampant in our downtown cores now, and it's playing out for everybody to see. And it's becoming a huge struggle for, as I said, not only the business owners, but tourism and cities as we try to deal with the crisis.
Some people might say, it being out in the open for everybody to see maybe is the way that this should be addressed. But I imagine this must also be causing fractures within the communities.
It is. And so you have that position where I would say 100% of everyone says we want to help these people. But I will say that there's frustration when it's the 10th time or the 20th time or the 30th time that the same people are having the same struggles, and the business owners are saying, I'm tired of trying to help now, and they look for some type of other solution. And that's where they come to mayors, or that's where they are trying to go constantly to the police, which we, again, are not equipped on a healthcare issue to try to respond to. So the frustration is growing and growing and growing. And that's why we've been calling for an emergency meeting with the province in regards to this issue. I will just say, it's not just the Ontario Big City Mayors Caucus. Since we put out the call for the emergency meeting, the Ontario BIA Association has joined the coalition, the Ontario Chiefs of Police, the Ontario Chamber of Commerce, the Ontario Tourism Industry of Ontario, Ontario Mental Health Association. They have all joined the call to try to have a meeting where we can actually put solutions on the table to try to help people and our downtown cores, especially the business sectors that are really experiencing a lot of this issue.
We've got maybe 10 seconds. I imagine with everybody coming together the way that they are coming together, this must have a significant financial cost to businesses.
It does. And in fact, it's not only because of sometimes damage to their businesses, because of some of the outcomes of some of the addictions that are happening, but insurance rates are now going way up for people because of constant damages to their businesses. As I said, without damages, they're also losing some customers because people don't want to come to our downtown cores anymore, seeing what's playing out. So support local, everybody. Still support our downtown businesses as we try to figure out this crisis. I know we can get through it and help people and help our businesses at the same time.
Thank you so much, Mayor. We appreciate your time and your help with this and helping us understand this complex issue. Thank you so much.
Thanks for having me.
Ontario went from 0 cannabis stores to almost 1,500 in just over 3 years. In some neighborhoods, there are 2 or 3 or more just a few blocks apart. It's got people talking about oversaturation and a correction in the retailing of pot. With us now to explain, Mitchell Osak, president of Quanta Consulting, which specializes in the cannabis and psychedelic industry. Hi, it's so nice to meet you.
Great to be here.
Well, from your perspective, how has the Ontario government handled the retail rollout of cannabis?
It's been the best of times and it's the worst of times. The worst of times was the beginning of the rollout, where the AGCO, which is the the provincial department responsible for awarding the licenses, was very slow off the mark because they weren't prepared for legalization. And at that point, they didn't have a lot of resources and manpower to be able to start awarding licenses. They quickly ramped up to the point where they've been giving out many, many licenses to many, many operators. So we've basically seen a hockey stick of license approvals, very slow at the beginning and then shooting up in the last year or so.
Well, you know, before we started taping, we were talking about something really, I think, which is really interesting to understand in this space, the different players of this new world that we're in. Can you give us just a quick overview of that?
So this Greek drama has 3 major villains, so to speak. You have the government, which we just spoke about, and its various levels of government that have contributed to the problem, but also created the right regulatory framework for an industry to germinate.
And that's the federal and provincial government.
Yes, and municipal. And, you know, they're not missing in action when it comes to the cannabis industry. Then you have what's called the licensed producers. Those are the suppliers of cannabis products, whether it's flower or pre-roll or edibles. And they've also played a major role in the growth and the challenges of the industry. And then the third major villain is the illicit market, or the folks who were in cannabis before legalization, growing and selling cannabis products to consumers.
So would you say that things have not gone well overall because of so many different players in this?
It's been a mixed bag of success. In Canada, cannabis sales, legal sales are growing very quickly. We're expected to reach about $4 billion Canadian in sales by the end of 2022. And that's only after 4 years, essentially, of legalization. That's the good news. The other good news is that no one has died from the consumption of cannabis, and the illicit economy as a percentage of total cannabis sales in Canada, as well as in Ontario, is roughly 50% of the sales. So we're making amazing headway. The problem in the industry is that the licensed producers or the suppliers are struggling with profitability, and that's created a real issue, both from a job security perspective from employees, as well as shareholder returns for the investors.
Well, if the numbers are going up for people using, why are they struggling?
Because the federal government has awarded so many licenses. I think the amount now is close to 800. There's too much competition. There's too many
Provincial
growers.
government?
The federal government.
Okay.
So the federal government, Health Canada, is responsible for awarding cultivation and processing licenses to operators. And they've awarded roughly about 800 across Canada. Those producers have dumped and grown and dumped a heck of a lot of cannabis product on the market, which has depressed prices. And at the same time, you have a situation where the illegal economy is still there, and they've also dropped their prices. So you have falling prices, which is very good for consumers, but not very good for operators and investors.
So who operates the retail space? Is it the provincial government?
In Ontario, it is private sector based. So you have entrepreneurs, you have chains that are based in Ontario and based elsewhere who are running stores.
Well, you mentioned that in the last 4 years it has gone up. What role did the pandemic play in that?
The data is sketchy, but directionally it looks like cannabis consumption went up during COVID, and that traces to a lot of factors. One thing we've seen with alcohol and gambling, for example, is that in very difficult times, those consumption of those products stay the same or go up. We saw the same effect with cannabis.
During we were talking before that we started taping I moved during the pandemic, and unfortunately, like every other neighborhood, a lot of the businesses were shut down. But since then, we have 2-3 shops. What are the rules around that, where these shops can be? Because I also see them in the malls. Is that part of the problem?
The retail landscape in Ontario is like a big piece of Swiss cheese. There are pockets where...
By the way, I love these analogies.
Well, I can't think of a better one. You have lots of areas where you're not allowed to have cannabis stores, and those are primarily within 500 feet of a school or a daycare center. So if a school can see a cannabis store, there's no way the AGCO will allow that store to open. You have other areas, like in malls, where you're not near any schools. And because of that, you tend to get a lot of clustering of stores in particular parts of Toronto, as well as other municipalities. And that's why in places like Queen Street and Dundas and Avenue Road, where I live, you have lots of stores. And in other areas, you have no stores.
Like Mississauga, right?
Yeah. About 66 municipalities have opted out of allowing cannabis stores within their legal boundaries. So Mississauga, Vaughan, Richmond Hill, Oakville, as well as probably 60 others, have not allowed cannabis stores to open.
Well, you mentioned all the stakeholders that were at the table, and communities, I guess, is one of those stakeholders. These municipalities opting out, has that hurt the business or has that helped?
The question is, hurt whom and helped whom? It certainly hurt the health of the retail sector in general, because if you can't be in Mississauga, you're going to cluster in Toronto.
But is that good for business to have so many people?
Absolutely not. But what's happening in Mississauga is that those citizens are either going and buying in the illicit economy, which is still flourishing in Ontario. Roughly 50% of the sales still go in the illicit economy, or those people are driving into Ontario or other municipalities where you're allowed to buy legal cannabis.
What about smaller towns?
Same story. These 66 municipalities are across the province. They're not just in the GTA area.
Well, when the Tory government came in, it stated that they wanted a free enterprise was the way to go to approach the rollout for retail cannabis, but not have government control like the Liberal government wanted to do the LCBO model. Does the province have a more free market now?
It does. The problem is that the Ford government, and this has happened in almost every other province in Canada, still authorizes a monopolistic wholesaler, which is called the Ontario Cannabis Store in Ontario.
So you have one person you can go to get all this cannabis?
Correct. And the Ontario Cannabis Store sells to all the retailers, and all the licensed producers have to sell to them. So they are a master distributor, but at the same point, they can also sell direct only online to Ontario consumers. So they're playing both roles. And, arguably, if you talk to a lot of retailers, they're not happy having to deal with the Ontario Cannabis Store.
Well, why?
For one thing, markups. The OCS marks up products anywhere from, say, 40 to 60 to 70%. That's number one. So consumers and retailers are paying a higher margin than they normally would from buying through the Ontario Cannabis Store. And number two, the OCS has had some operational challenges. This is all public knowledge, but there was a recent cyber attack in August where the OCS suspended deliveries to retail stores and then limited those deliveries to retail stores. So it hasn't always been easy for retailers in Ontario.
Oh, there's no one here from the government, but I'm guessing, and I don't really know this space very well, so correct me if I'm wrong. I'm guessing maybe the OCS is, their position is that having one place where everybody can go makes it fair and also safe. Is that a reasonable argument?
It's more than a reasonable argument. A lot of licensed producers only want to sell and collect money from one buyer, and that's the OCS. So the licensed producers in many cases like dealing with a single government body like the LCBO because their business is much simpler. So if I'm growing cannabis, say in Manitoba, and I want to sell to Ontario retailers, I just have to deal with the OCS, I just have to ship to them, and they fulfill or distribute to all the retailers in Ontario. So for licensed producers, it's not a bad deal, and that model makes a lot of sense from an economic perspective as well.
Well, do you think the government should have gone the way the Liberal government wanted to with the LCBO model?
That is a difficult question to unpack simply because it's part politics, and we know, when it comes to these types of products, politics are important, but it's also part resourcing and taxation. There are two major models in Canada, and I'll quickly summarize them. You have Saskatchewan, where you have no government wholesaler, and it's all in the private sector. They take a much smaller markup. And to a certain extent, that's better for consumers and better for licensed producers.
Why?
Because the prices are lower. Because it's easier to deal with the illicit market. So when the prices are lower, people have less incentive to go to a dealer to buy their product.
Because the dealers are cheaper.
Right. In Ontario, where you have those significant markups, it becomes more expensive to consumers. And that value proposition of being in the legal market becomes a lot lower than it is going to your old buddy who used to sell you weed for a lot lower price and sell it, by the way, more conveniently, whenever you want, in a backpack, when you could sample it.
Any other jurisdictions doing it right?
The question is how right is right. I don't think anybody's doing it really wrong, and I don't want to dump all over the OCS because, as I mentioned before, there is a lot of value there, and they do a terrific job of educating consumers. I think the province that does it the worst is Quebec. What Quebec does is limit the number of stores. They, for a province that has roughly 20 to 25% of the Canadian population, they have 100 stores. For perspective, Toronto has 450 stores.
Wow.
So Toronto, which is smaller than the province of Quebec, has 4.5 times more stores. Quebec also limits edible sales. They have a higher age of majority than we do in Ontario. So the Quebec market is much more restrictive, and consequently, I don't think it's doing its best to combat the black market, which is what we're doing in Ontario reasonably well.
And what are edibles, just in case some people don't know?
They're gummies, they're cannabis beverages, they're brownies, they're anything that is consumed not through a combustible process.
Well, we're already, the pandemic is still here. A lot of businesses are still struggling to get up from the ground. What would you suggest the government here in this province can do to make the situation a bit more equitable?
For one thing, excise and federal taxes are extremely high in cannabis, to the point where, and I don't want to get into a whole conversation and bore your viewers on taxation.
We like nerdy
policy.
stuff.
Yeah. Let's just say taxes make up roughly 25 to 35% of the total cost of goods sold.
Wow.
Of a gram of flour. And that's a big problem. So the money that should be going to either lower costs for consumers, higher wages, research and development, or what have you, is going to government coffers. And that's a problem for the industry. Because the industry is being starved of the capital and profits it needs to thrive.
What other solutions can we come up with?
There's a couple of things. If you look at THC limits, on edibles, you're limited to 10 milligrams per.
What is that, THC?
THC. That's the psychoactive that makes you high or makes you happy. You're limited to 10 milligrams per unit. In places like California, you can get a brownie with 100 milligrams of THC or 150. Even in the illicit market, Ontario, you can get that. So those potency limits continue to drive consumers into the illicit economy because they can't get the assortment they need to be able to get in things like edibles here. The third area where it's a big issue is in terms of how do you brand or what can you say about the product. We know we may hate advertising, but advertising educates us and it tells us what the value of particular products are. Health Canada has serious restrictions around what you can say about cannabis, what you can put on a package, and that reduces consumer education and as well drives people into the illicit market because your dealer, your buddy will show up and tell you what the psychoactive effects of this particular flower will be for you.
I wonder though, because this is such a new space for everybody, you were talking about the potency. Do you think that maybe some of these restrictions are in place just because of the safety aspect? You said that no one's been hurt so far from cannabis use since the rollout. So do you think maybe there's still a bit of like growing pains around this industry?
Excellent observation. Absolutely growing pains. It's still early. It took Amazon 15 to 20 years to make money. So the fact that a lot of licensed producers aren't making money, we shouldn't be too concerned about it. The problem is that many of them are in danger of failing. So to the extent that we're still in the first period of this hockey game, absolutely. Companies are getting better, products are getting better. One of the express objectives of cannabis legalization by the federal government when it came out was health and safety and reasonable consumption. And those objectives has been met by and large in spades. The challenge now is to loosen them up a little bit. We were very successful early on, and most sensible, reasonable people, including almost everybody in the industry, wanted sensible regulations that erred on the side of caution. We're almost 4 years into it. It's time to loosen it up. It's time to let companies compete a little bit better. And it's time to give consumers more choice and lower prices.
And maybe take the training wheels off a little bit.
Yes. I'm not a big believer in the nanny state. If you look at the, cannabis versus alcohol, cannabis from a social policy perspective. When you look at drinking and driving, domestic abuse, violence, cannabis is much more benign than alcohol. Yet you have much more liberal marketing rules around alcohol and sponsorship and so on and so forth. You don't have that in cannabis.
When I was in university where, a lot of people do a lot of experimenting, I never thought that I would be on a television show talking about cannabis being legal. So baby steps, I suppose.
Yeah.
Mitchell, thank you so much for helping us understand this complex issue. We appreciate your insights.
It was a pleasure. Thank you.
Thank you. That is the agenda for Thursday, September 15th, 2022. Tomorrow, the one and only Buffy St. Marie. I'm Nam Kiwanuka. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.